Veterinary medicine is a messy business both physically and emotionally. Vetsplaining is one veterinarian's attempt to explain and understand her own profession a little better. Join Dr. Lisa McFaddin as she delves deep into the medical and business aspects of veterinary medicine.
It is time to learn about wellness blood work. So the first question we want to ask is, why do we recommend the wellness blood work? And the primary answer to that is animals cannot talk. So they frequently hide their problems until they're really, really sick. If you think about it when they're in the wild, you don't want to show that you don't feel well because you're going to get eaten. So instead, you hide it until you just can't hide it anymore. And this way, we enact the second reason, which is prevention. And early intervention is always better than the Band-Aids you can provide if you have to start treating chronic disease. And then the last reason is if we're monitoring chronic diseases, especially in our senior patients, we're going to want to do routine blood work to make sure that what we're trying to do is actually helping. The second question is, when do we recommend wellness blood work? And the first time we run what would be considered wellness blood work is when the animals are between 6 months and 14 months of age, and that's usually at the time of their spay or neuter. So technically, I guess, why do we recommend wellness blood work? We could put pre-anesthetic in there because we're assuming in general that they are healthy enough to undergo anesthesia. We just want to make sure that liver, kidney function especially, and red and white cells are normal and that they'll be able to tolerate the stress of the anesthetic procedure. Adult dogs and cats, so at Independent Hill, we consider adult dogs to be basically between 1 to 8 years of age and cats between 1 to 10 years of age. I recommend running blood work ideally annually, but realistically, if they're happy, they're healthy, then every other year should suffice. Again, it's more of a, we want to make sure everything's okay. And then when they're considered senior pets, so for dogs greater than 8 years of age and for cats greater than 10 years of age, I recommend doing it annually, ideally every 6 months, but generally do it annually. Now, if they have chronic illnesses, then we're going to definitely want to monitor more frequently, and kind of long-term, we monitor every 6 months. And the blood can be run in 3 different places, really. It can be run in the reference laboratory that we use, and that's IDEXX Laboratories. And that is, if you ever go to like your doctor, you may see those little boxes with locks on them that sit outside the door. Those are the boxes that you put the samples in. And then there's somebody whose job it is to basically like drive from practice to practice for human and veterinary and pick up the samples and take them to the centralized location for the lab reference center. We can also do in-house blood work, and then some tests, generally not wellness blood work, but some more specific tests, we need to actually send to veterinary university laboratories. Another really common question when talking about wellness blood work in pets is, what determines the cost? And there's really 4 things that determine the cost of the blood work. First, there's the price set by the laboratory itself. And that's based on the cost of supplies, and that includes our in-house laboratory. Then there is the supply cost involved in drawing the blood. And then there is the technician and doctor time to draw the blood. And then finally, there is the doctor interpretation and treatment plan development time. And a lot of that isn't just the time that they call. It's more actually reviewing the blood work, interpreting it, and figuring out, based on what that blood work says, what we should do next. And hopefully, at the end of these podcasts, and this is actually going to be one of 3 that talks about wellness blood work, you'll understand why that interpretation and treatment plan development is actually much more complicated than you would think. And blood work interpretation is, I think it's really interesting because it's kind of like a puzzle. But it is complicated, and it's not just as simple as looking at the values and just saying, we're going to do this. So as we get into more detail, I think you'll realize why it is that it takes a lot of smarts, and it takes a lot of understanding, and realistically a lot of re-looking things up, because you're never going to remember everything that you learn. And that's why part of being a veterinarian and a human doctor is knowing where to look when you have questions. So we then have to ask, all right, well, what tests are we going to run? And we're talking specifically about routine baseline blood work. And the exact components are going to depend basically on like what the vet wants, what the animal, their breed, their age, their sex, and any pre-existing conditions. But in general, it includes what's called a complete blood count, or CBC, a chemistry panel, and there's a variety of tests that can be included in that, an electrolyte panel, and then it may include thyroid testing, and it may include urine testing. So for the rest of this podcast, we are going to talk about the complete blood count, or the CBC. And just as kind of an aside, I do an every other week Facebook Live video for Independent Hill, and next week I'm actually going to talk about the CBCs on there, and there's going to be like making these little visual cue cards. So for people that have kind of a hard time imagining what I'm describing and or are more visual learners, that might actually be a nice little aid for this information. And if you're going to watch our Facebook Live video, don't forget to like us on Facebook. There's my little plug. All right, so CBC, complete blood count. This is an evaluation of the actual cells within the blood. So there are red cells, white cells, and platelets. And the red blood cells, their fancy term, because remember, in medicine, we always have to have fancy terms because it makes us sound important. They are called erythrocytes, and they carry oxygen throughout the body. Then you have your white blood cells, which are called leukocytes, and they fight infection and are a part of what we call our immune system. And leukocytes is the general term for all of the different white blood cells that we have, and in cats and dogs, there are 5 that we're talking about. And then lastly, you have the platelets, which their fancy name are thrombocytes, and those are your clotting proteins, and they help indicate how quickly your cat or dog can clot. So first we're going to talk about the red blood cells, and just to warn you, this is actually the most complicated, and I think one of the more interesting parts of the CBC. So erythrocytes, or red blood cells, they carry oxygen, as we said. So there's different ways to measure the amount of red blood cells. So there's something called a hematocrit, or the abbreviation is HCT, and that's actually the percentage of red blood cells. There is another way to measure the percentage of red blood cells, and that's called your packed cell volume, or PCV. The easiest way to think about it is a hematocrit is measured on a machine. So you draw your blood, you put it usually in a purple top tube or a lavender top tube, and that is a little plastic tube that has a tiny bit of EDTA, which prevents it from clotting. And then you put it in the machine, and the machine sucks a little bit up, and then it runs all these tests, and it gives you your numbers. And the hematocrit is a machine-calculated percentage of red blood cells. A packed cell volume, or PCV, is a manual counting. So we take this really tiny hematocrit tube, it's really thin capillary tube, and we fill it with a little bit of blood, put some clay in the bottom, put it in this cool little spaceship looking usually centrifuge, and it spins, and then you pull it out, and then you use this guide to then measure, based on this kind of like triangular chart, what percent of the red blood cells are. And they're usually different, but they should be fairly close. And I consider the PCV to be a more accurate measurement. So anytime we run a complete blood count in-house, we always have to run a PCV with it. It's also a nice little tool to make sure that your CBC, if you're running it in-house, actually is accurate. Because if your PCV is, let's say, 10%, which is crazy low, and your hematocrit on your CBC machine is like 59%, well, then something's wrong. Somebody did something wrong. So either we read the PCV incorrectly, or we need to calibrate the CBC machine. But it's just a nice little double check. But if you send blood out to a reference lab, they're just going to give you the hematocrit. Again, percentage red blood cells. And then there's what's called the RBCs, which is basically the number of red blood cells. And then there are the reticulites. Those are your immature red blood cells. And they are produced by the bone marrow, and they can be stored there. They can also be stored in your spleen. So think of your spleen as like this sponge that lives in dogs and cats, like in the front to the left side of the abdomen. And it basically is a little sponge of red blood cells. And it has a lot of immature red blood cells, or reticulocytes. So then we talk about how we describe red blood cells. And there's a couple of descriptors. So there's what's called the mean corpuscle volume, or MCV. And that just is a fancy way of saying how big the red blood cells are. Then you have the mean corpuscular hemoglobin concentration, or MCHC. And that is just basically a way of describing how much hemoglobin is within the red blood cell. And the hemoglobin is that protein in the red blood cell that's going to carry the oxygen throughout the body. Because your red blood cells, right, their main job is to carry oxygen throughout the body. And if you don't have any hemoglobin, then they're not really doing their job. And so another way to kind of think about the MCHC is your hemoglobin is what gives your red blood cell its pallor or its tint, its color. So the higher the MCHC, the darker the red blood cell, the lower the MCHC, the paler the red blood cell. Then we talk about our shape. Normally, red blood cells are round with like a slight dip in the center. And abnormally shaped red blood cells can be seen in cases of anemia, if there's too many red blood cells, and sometimes you can see abnormally shaped red blood cells normally, just kind of every once in a while, or if you're not anemic, but you still have an issue with your red blood cells, you may see abnormally shaped red blood cells. So then we have all these descriptors for what those abnormally shaped blood cells look like. So the most common ones that we talk about are spherocytes. So those are red blood cells that are really too spherical, right? They're totally round. They don't have that little dip in the center. And that is most often seen with what's called immune-mediated hemolytic anemia. So that is a fancy way of saying your body hates its red blood cells, and so it's destroying them. And one of the things that can happen is there's a error in the way that the red blood cells are formed. So it's usually like there's a protein missing or incorrectly produced by the body. And so you get, instead of those kind of discoid shaped cells, you get spherocytes, which are round. And then the spleen thinks that they are old red blood cells and starts to kind of destroy them even more and eats them up. So then the spleen's kind of like Cookie Monster. And it's like, nom, nom, spherocytes, nom, nom, nom. And then that kind of contributes to the anemia that develops. There are other types of abnormally shaped cells, so target cells. And those are most often seen with iron deficiency. They literally kind of look like a bullseye. Then you can get these blunt projections on the red blood cells called acanthocytosis. And those are abnormalities in the red blood cell membrane that we frequently see with certain types of toxicities, liver diseases, and rattlesnake envenomation. And then there's fragmented cells, or schistocytes, which I don't know why, but always makes me think of Wayne's World. But schistocytes indicate that there are damage to the red blood cells as they pass through circulation, and we frequently see it if there's clotting problems. So when you look at red blood cells, you can have too many or you can have too few. So we're going to talk about too many first. So there's two forms of too many red blood cells. There is hemoconcentration, which is basically a mild increase in the red blood cell count. And you can see that due to dehydration or stress. And frequently, the size and color of the red blood cells are normal. And those reticulocytes that we talked about, the immature red blood cells, may actually be increased even if there's a normal or slightly elevated hematocrit concentration. And that is because cortisol or stress makes your spleen, I call it a spleen squirt. So you get stressed out and your spleen's like, ee! And then it just releases a whole bunch of immature red blood cells into circulation. And it's very temporary, but it can result in an increase in your percentage of red blood cells. It's not harmful, and it usually goes away on its own. If you're dehydrated, generally it's what's called subclinical, meaning you can't appreciate it on physical exam, and then you just have them drink water and it goes away. Realistically, you don't necessarily need to dress anything because the animal will drink water itself because it's very good at regulating itself. The body loves homeostasis. And then the other actual pathologic or problematic form of elevated red blood cells is called polycythemia. And that is an increase in red blood cells because more than normal amounts of red blood cells are actually produced by the bone marrow. And there's a few causes, and polycythemia as a general rule in veterinary medicine is uncommon. And the causes, obviously, are uncommon because the disease itself is uncommon. But you can have a genetic mutation in the bone marrow, and that's called polycythemia vera. And you can have decreased oxygen in the blood, and it kind of tricks the body and makes it think that it needs more red blood cells. So if your body doesn't have enough oxygen, then it may say, oh, I don't have enough oxygen because I don't have enough red blood cells to carry hemoglobin, so I'm going to make more red blood cells so they can carry more hemoglobin, so I'll have enough oxygen. And the most common causes for that, again, uncommon in general, are congenital heart diseases, chronic lung issues like the animal version of COPD, what's called brachycephalic airway syndrome. So those are your like squish-faced dogs that are when they come in. And then altitude sickness, and then certain cancers. Polycythemia can actually be life-threatening if the red blood cell count is too high, because it can actually make the blood thick and it can cause sludging. So If the blood is too thick and it can't move through the veins, can't move through the vessels, specifically the arteries, but also the veins,